Breaker 19, this here's a rubber duck. You got a copy on me, Pigpen? Come on. Yeah, 10-4, Pigpen, for sure. By golly, it's clean clear to Flagtown. Come on.
Evidence suggests that low back pain affects nearly 80% of the population throughout their lifetime, and nearly 20% of Canadians live with some type of chronic pain. A comprehensive assessment and detailed movement examination to identify problem areas and tailor treatment to the patient's specific symptoms are necessary as future physical therapists. Physical exercise is recommended to prevent consequences of low back pain, such as an absence at work and occurrence of further episodes. By understanding patterns of low back pain, we can use exercise to help relieve symptoms and improve our patient's quality of life.
Our client is a 45-year-old male truck driver with low back pain. His past medical history includes type 2 diabetes, smoking 1 pack a day for the past 25 years, and he had a right medial meniscal injury at the age of 17. MRI findings suggest a posterolateral disc bulge of L4-5.
So Bruce, tell me a little bit about your pain.
Well, I'm a truck driver, right? And after about an hour on the road, I just get this sharp pain into my back, and it goes down into my right tush here, and It's really bad.
Okay. Does it go all the way down to the foot or just to the knee?
It goes just about down into the edge of the butt here.
Okay.
Yeah.
And any numbness or tingling or anything like that?
Yeah, a little bit of numbness, but I can't really describe it. It's kind of random.
Okay. And if you had to rate your pain, what would you rate it at its worst?
Oh, right when it's happening, I can barely drive. It's like a 9 out of 10.
Okay. And how long have you been driving until you feel that happen?
About an hour.
Okay.
Yeah.
Anything that makes it better?
Honestly, it's always there, but sometimes when I get on my truck and walk around at a stop, it feels a bit better, but It's always there.
Okay, sounds good. Any previous activity that you used to do, or?
Well, I used to be a pretty good high school football player, middle linebacker on my high school team, and so I was playing a lot of sports when I was younger, but now I got a gym membership now. I don't go a lot, but I got it.
Okay. Anything else you wanted me to tell me before we get started here?
No, I'm really excited for exercise, though.
Okay.
Relevant clinical findings include reduced lumbar flexion and side flexion range of motion, L4 root symptoms, positive lumbar compression test, tight hamstrings and hip flexors, poor sitting and standing posture, decreased walking endurance, and globally deconditioned. Research has shown that individually designed programs, including stretching or strengthening, may improve pain and function in chronic nonspecific low back pain. Furthermore, 2 systematic reviews found a beneficial effect for strength and resistance and coordination and stabilization exercise programs over other interventions in treatment of chronic low back pain. For example, emerging research has shown that deadlift training may be a successful treatment for subjects with low back pain of discogenic origin. This is why we have included it in our program as one of our major lifts. Finally, a randomized controlled trial indicates that whole-body periodized resistance training can be used by training and conditioning personnel in rehabilitation of those clients suffering from chronic low back pain. Overall, resistance training has been found to be effective in treating individuals with low back pain. Based on the research and our patient's profile, we have created an exercise program based on a combination of a top-down, bottom-up approach. We initially started with a bottom-up focus to introduce movement patterns to our previously inactive patient. As his movement pattern progresses, we will move towards the combination of a top-down, bottom-up approach. The benefit of combining these 2 approaches are that we will be able to employ bottom-up progressions to strengthen our patient's movement pattern, but we will still be able to address the mobility and movement capabilities.
Our client's relevant problems include pain with prolonged sitting and altered sensation into his right leg, poor posture, impaired strength and flexibility, and globally deconditioned. As a result, we have diagnosed him with chronic low back pain of mechanical origin with a compromised L4 nerve root.
Our treatment goals focus on improving posture, educating on relief positions, and implementing seating ergonomics to manage symptoms throughout the day, beginning a therapeutic exercise program to improve mobility, strength, and conditioning, and ultimately we want to improve his function at work and in daily activities.
So for the first phase of our program is going to be about 0 to 2 weeks in the early rehab. Here our main focus is going to be pain management. We also want to focus on our posture and ergonomics through movement and our exercises that we're going to prescribe. We want to teach a lot of education on Bruce's body awareness and his mechanics throughout the movements that we're going to do with him. And then we also want to focus on developing a framework for the bigger lifts that we're going to be looking at later on in the program. So the second phase of Bruce's exercise program is going to be the initial loading phase, weeks 2 to 6 in his program. With this one, the emphasis is going to be on form. We're introducing load through his available range, and we're developing that strength right off the bat in the range he has. Then we're going to be prescribing him also some accessory exercises to continue to work on mobility, improve core stabilization, and get the full range he needs. Phase 3 is going to be a progressive loading phase. This is going to be in weeks 6 to 12. We're going to start increasing his load on the lifts he's been doing. We're going to start progressing the lifts to get fuller range. We're going to maintain and continue to improve his mobility. And then we're going to progress some of the accessory exercises for his core stability and challenging some of his balance as well. The last phase of the program will be greater than 12 weeks, so we'll lead it up all the way to about a year. It's going to focus on maintenance and then also some more progression. So we're going to continue to increase the load as he is able. We're going to make sure he has an increased level of confidence with his program and that he can carry out the program on his own. And this one will feature all of our main lifts, hopefully full range. So in addition to the main exercises we showed in the videos, we would prescribe Bruce some accessory exercises, either to do as a warm-up or to do at home. Things that include thoracic spine extension and rotation, and also stretching program, focusing on the hamstring and hip flexor, anything posterior chain. We'd also give him some sloppy push-ups for pain management in that first initial stage, and then as we progress through the program, we'd be wanting to challenge his balance a little more. Things like a single leg balance going into a standing single leg airplane, even into the single leg deadlift, or a lunge or split squat, and adding load as we go. So in summary, clinicians that work with clients experiencing low back pain should ensure that they conduct a thorough assessment, that they tailor the program to the individual, and then they make sure that the program is fitting the individual's goals and their interests. It's really important to make sure that they have a strong strength component and a loading component into their exercise program, as the research does support the use of strength training as part of rehabilitation for low back pain. Ultimately, we want to challenge the client and give them their best opportunity to succeed.
Looks like we got us a convoy.